It's 2 o'clock. We'll start.
Good afternoon, Doc.
So welcome all. Reminders, please mute yourself, but always show your video picture. Sign in your name, Facebook account, email address in the chat box. Include names of your companions attending. Use the chat box to ask questions and make comments while the pep talk is on. Group pictures at the start and end of pep talk. So show your face in the video. Reminder, please take the online learning cum evaluation test exercises for mastery of learning and have a perfect score to get a certificate like the one shown below. I'll give you the link later on. I'll put it in the chat box. Okay. So let me just report to you that as of August 7, today at 12:30, 22 have completed all the past OLETE pep talk with OLETE passers. Thank you and congratulations. Okay. There are 19 mentees catching up. Thank you also and congratulations. So that probably will make up about a total of 42, okay, regular mentees. I hope we can have more. So again, welcome, mabuhay. Let's now have a group picture before we start in 2 minutes. Okay. So let's have a group picture. I think there are 2 pages to consider. Okay. Ready? Everybody ready? With your beautiful faces. 1, 2, 3. Okay. Let me just save it. So page 2. Okay. Please show your face. Show your beautiful faces. One. Nakaabol. 1, 2, 3. Okay. So 2 pages. So as an intro, I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. I launched this pep talk on May 15, 2021 with the module on COVID-19. The second module was on patient empowerment. The third module is we are on the third module. It's called patient management process. So what I have in mind in my pep talk, which may run for 3 years, is to empower at least 30 persons with my family members and my patients as a priority. That is my key performance indicator. I hope you'll be in this group of 30. So now we already have 42 active regular mentees, and I'm happy for that. I hope we can have more. So my pep talk today is entitled Patient Management Process, Advice to Patient Process. The empowerment objective is for the lay people to have an understanding of the advice to patient process in the patient management process. So this is the patient management process framework, which we've been discussing for the past 5 meetings. This module on patient management process has 6 parts: overview, clinical diagnostic process, paraclinical diagnostic process, selection of treatment process, advice to patient process, and peculiarities and limitations of medical practice. we're done with the 4 other parts before. We're now on the 5th part, which is advice to the patient process. Okay. So we will be focusing on the boxes which are outlined by the red box, bigger boxes. Okay. Advice to patient process. Advice is one of the basic functions of a physician during management of a patient. After the advice, if there is a decision that has to be made, and before anything is executed by the physician, there must be an informed consent, given and usually officially signed by the patient. The word informed before the consent means the patient has been advised properly by the physician prior to the patient giving the official consent. Advice is seen and expected in the following steps in the management. Here in the first box, after the interview and physical examination, and after the physician has arrived to a clinical diagnosis, the next step is to advise the patient on the nature of his health problem. On these 2 boxes, okay. After the clinical diagnosis has been explained to the patient and his relatives, the next step is to advise whether a paraclinical diagnostic procedure is needed or not. If a paraclinical diagnostic procedure is needed, the patient is informed of the various options. He is advised on the most cost-effective option. And performing the paraclinical diagnostic procedure can only be carried out after the physician has secured an informed consent from the patient. The next box, after the paraclinical diagnostic procedure has been performed, the next step is to advise the patient on the results. So, before the selection of the treatment options, the physician spells out and tells the patient the pre-treatment diagnosis with specification of the objectives and goals of the treatment. Okay. So this forms part of the advice of the physician to the patient. After the pre-treatment diagnosis is stated and the objectives agreed upon, the next step is to inform the patient on the various options of treatment. He is advised on the most cost-effective treatment option. Again, carrying out the treatment procedure can be done only after the physician has secured an informed consent from the patient. During the treatment, the patient is advised on the preparation, progress, outcome, and any adjustment that have to be made. And after treatment, the patient should be advised on the subsequent management, specifically on the follow-up or check-up. The patient should be given advice on health restoration and maintenance as well. So at this point, I'd like to share with you my thoughts, perceptions, opinions, and recommendations on advising patients and relatives. This is how I usually do it. A physician or any healthcare professional deals with both patients and the relatives or guardians. A successful physician-patient-relative relationship is based on the establishment and maintenance of good rapport initiated and accomplished by the physician. A good rapport basically emanates from the trust and confidence given by the patient relative to the physician. This trust and confidence can be gained by the physician through many ways. The following are some qualities of the physician that will promote trust and confidence of the patient relatives. Competent physician, honest physician, gentle, compassionate, meaning showing concern, courteous, patient persevering and understanding. Advising a patient and his relatives is a major pathway through which a rapport can be established and maintained by the physician. In managing a patient, advising is usually needed on the following: clinical diagnosis, the need and nature and results of the paraclinical diagnostic procedure, pre-treatment diagnosis and objectives of the treatment, selection of treatment, outcome of treatment and prognosis, and then health restoration and maintenance after treatment. The following are tips in advising. Always include the relatives of the patient in advising if they are available. Assess the psychological makeup, the health beliefs, and the level of competency of the patient and the relatives before making advice. Make strategies that will promote rapport with the patient. Be honest, but not brutally frank. For example, slowly divulge the diagnosis of an incurable disease or terminal disease or a frightening disease. Use terminologies or explanations that can be easily understood by the patient and the relatives. Use all kinds of strategies that will make the patient and his relatives like you, the physician. Explain to the patient and relatives the processes you use in arriving to a diagnosis, recommendations for a particular paraclinical diagnostic procedure, and treatment. So takeaway in this pep talk that are related to patient empowerment. Understand the patient management process framework in terms of what and how the physician should advise patients and relatives. Be ready to ask questions if the physician is not advising you properly and adequately. Participate actively and fully in the problem solving and decision making of your health concerns with your physicians by first listening, then analyzing their given advice, and then decide. Master the advice topics that you need to hear in each step of the patient management process, as they may help you in some way in deciding for your own health concern on how to problem solve and do decision making, particularly when there is no healthcare professionals or physicians around to assist you. This is one other way of gaining control, greater control in your health concerns and issues. I'd like to add another subtopic here. Okay. How I have been advising patients. I'll give you some illustrations. So this is an old record far back in 1988. I started my practice in 1982. Okay. So showing you how I had been advising patients, findings with illustrations, possible diagnosis, recommended diagnostic procedure, result, and treatment. Okay. So 40 years old in 1988. So the chief complaint, breast mass, noted 4 days ago. Okay, 4 days prior to consultation. Okay, so I have an illustration to show the patient the findings. Okay, then I try to explain to the patient what that mass is all about. It could be benign or cancer. Okay, so then I would recommend a biopsy procedure. Okay, and then probably advise them if it turned out to be cancer, you might need an operation. So with the consent to do the needle evaluation, needle biopsy, I was able to aspirate 1 cc of pus, so which I told the patient, and it's the diagnosis here is a breast abscess already. So, okay, so with that, with treatment, I gave an antibiotics. Okay. Over the years, I've been giving a copy of my medical or clinical medical records in my clinics, outpatient, to my patients. Okay, this has served as an advice paper okay, to them with a signature affixed to signify acknowledgement, understanding, and informed consent, or if the case may be, informed refusal. Okay, so the medical records include essentially the following: the name, the age, and the sex. Okay, so some background notes, in particular, if any, okay, particularly during follow-ups. Okay, so the purpose, so the concern or the problem being presented by the patient, and then whether it's a checkup on the second visit, whether it's a checkup or follow-up. Okay, so if there are new concerns, and then I include also the findings, okay, pertinent ones with explanation and drawing as much as possible. Okay, so this is to facilitate my explanation to the patient. I have to draw. Okay, and then I enumerate the signs and the symptoms, and then come out with the primary clinical diagnosis at least, and then with the reasons why I chose a particular entity as a primary clinical diagnosis. And then I gave recommendations with all the reasons and basis. And then I also, if there's a need for diagnostic tests, I gave all the options and then compared the benefit, risk, cost, availability of each option. And then coming to treatment, okay, I also lay down the options of the treatment with their benefit, risk, cost, availability comparison. Okay. And then I usually give an advice on self-monitoring after the visit, and then indicate the date or time as much as possible when they have to come back for follow-up or check-up. Okay. So this is a 2014 medical record showing that I have been advising patients. Okay. Okay. So this patient's name is this one, 56 years old, presenting with a neck mass, noted 2 weeks prior to consult, no pain. So she has a mass, a nodule on the thyroid. Okay. So I examined her, and then I told her the possible diagnosis initially, is it cancer or not? Then I put more lines here, meaning most likely it's cancer, okay, more than not cancer. And then I gave her the options, okay, notice here, various options, 2 options listed down here, biopsy, needle biopsy, okay, ultrasound of the thyroid gland, and then I put the come out with a table showing the benefit, risk, cost, availability. Okay, so after advising the patient, now the patient decided to go for biopsy. So the signature here of the patient signify an informed consent for the procedure. This is a 2020 last year telemedical record showing how I have been advising the patients. Okay. Okay. Again, 66-year-old female coming with a breast mass, big one, okay, 10 centimeters with skin discoloration. So my primary diagnosis, as I told her, is that it's a breast cancer. Okay. Okay. So the basis is that the mass, there's a mass there with adherence to the skin and nipple retraction. Okay. The probability of diagnosis in terms of degree of certainty is about more than 90%. Okay. And then I gave her the options and what to do, further diagnostic tests, and then options on the treatment. Okay. So I make sure that I have told the patients the findings, diagnosis, options, and recommendations. Okay. And make sure that she has understood everything and agreed upon. So whatever we decide upon will be a shared decision. Another telemedical record showing how I've been advising the patient. Okay, 70 years old. Okay, the symptoms. Okay, this patient comes for breast cancer surveillance. Okay, okay, symptoms. Okay, and then the signs. Okay, then showing the an illustration of the findings. No sign of recurrence. Okay. So the primary clinical diagnosis is no clinical evidence of breast cancer recurrence. Okay, this is what the patients usually would like to hear. Okay, so this patient is going on 38 years by October 2021. Okay, so the other problems I listed down here, and then the treatment. Okay, note here, I always make sure that I have accomplished this one. Findings, diagnosis, recommendations are given, explained, understood, and agreed upon. And then this is acknowledged by the patient. Okay, I have prepared a video, okay, to show you, but I will do it after the picture taking, okay, because I have shifted to another type of medium, okay. So I'll end this pep talk for a while at the moment, okay. Advice to patient process, okay. Reminder again, take the online learning evaluation test exercise or OLETE for mastery of learning and have a certificate if you get a perfect score. As I said, congratulations to those 22 who have completed the pep talk and have a passing marks on the OLETE. Okay, and then 19 are catching up. Keep it up. Okay. So let's now have a group picture taking before I show the video. Okay. And we have all the, wala pa. Ready? One. Habol, habol, habol. One, two. I see. Can you also help me take pictures at your end? Because I cannot. One, two. May pahabol eh. One, two, three. Okay. Page 2. Page 1. Okay, 1, 2, 3. Okay. Save ko lang ha. Okay, I will now show the video. Okay. Okay. So, ang ibig sabihin nito, ito drawing ko ha. Aba. So, ito yung esophagus mo, ito yung stomach mo, no? Aba. Okay. So, na-explain ba sa iyo ni Dr. Portigalidad? Na-explain niya ito? Na-explain niya? Kung saan?
Hindi po, Dok. Hindi niya na-explain.
Hindi knowing. Basta salita na lang.
Opo, Dok.
Okay. Ito yung tinatawag na cardia. Cardia. No? Nakikita mo sa report mo, nakalagay ito, cardia. Di ba?
Opo.
Okay. Cardia. No? Sa area nito. Kasi ang tawag dito, untrue. Ito, body. No? Tatlong party yan. No? Okay.
Opo.
So, naka-describe doon, endoscopy, nasa cardia, naka-describe sa CT scan mo, nasa cardia rin. Di ba? Sa banda rito.
Opo.
Ito yung nakikita mo, di ba?
Opo, Dok.
So, ang sinasabi rin sa CT scan mo, ito yung esophagus mo eh, no? Ito yung esophagus mo. Yes, Monica, ha? Yes, Monica. Nurse Monica.
Yes, po. Katabi ko po.
Ito yung esophagus. esophagus. Okay? So, ang sinasabi kung isasama natin yung picture nito, na yung nakikita natin, saka yung report ng endoscopy, ni prodigalidad, saka yung CT scan, no? So, number one, nakikita mo yung size magkaiba, di ba?
Yes po, Doc.
6 to 7 doon sa prodigalidad, isa sa CT scan, 45 millimeters, di ba? 4.5. Mga ganun.
Yes, Doc.
So anyway, estimate lang naman yan. Walang problema yan. Basta importante, talagang may bukol ka. No? So talagang may bukol ka nito. Ayan. No? Okay.
Yes, Doc.
So, and then, sinasabi nag-encroach malapit sa esophagus based on the CT scan. Di ba?
Yes, Doc.
Walang binanggit si prodigalidad kung gaano kalayo sa esophagus. No?
Wala.
Pero sa CT scan, meron. No? Sabihin natin, i-illustrate lang natin, baka andito. No?
Okay, Doc.
Okay? Baka ha? Okay?
Papa.
Lang. No? So, yes sa'yo, talagang may bukol. Ha? Kasi kung sabihin natin, CT scan, 4 point something, di ba?
Yes, Doc.
4 cm, di ba? Approximately. No? 45 is 4 cm. No?
Yes,
Then,
Doc.
based on the endoscopy, talagang kitang-kita. No? Kaya biopsy. Di ba? 6 to 7.
6 to 7.
Okay, pero let's just call it ganon, 4 to 5. Ganon. No? Okay, kitang-kita.
Okay, Doc.
So, yung ganito, so ang tanong nito kung ano siya, di ba? So, diagnosis kung ano siya, di ba? So, may biopsy ka, di ba? Tama?
Yes, Doc.
So, yung biopsy niyo, hindi siya parang kulang, no? Hindi na makukuha yung no? Okay?
Opo.
Yung sample, no? Pero sa akin, pwedeng hindi na ulitin. Okay? Okay?
Okay
Opo.
po.
Pwedeng hindi ulit. Wag mo na pa for biopsy, no? Okay? Kasi number one, ang diagnosis nito, probably at tinatawag na gastric stromal. So gastric na lang, nasa stomach lang naman. No?
Opo.
Stromal tumor. No? So, minalas ka, may tumor ka. No? So,
Opo.
okay. So, ito kasi yung mga tumor nito, pwedeng malignant, no? Pwedeng hindi. Pwedeng non-malignant, no?
Opo, Doc.
Non-malignant means hindi siya cancer, no? Pwede, no?
Opo, Doc.
Pwede ding malignant, no? Okay.
Yes, Doc.
So, pag hindi natatanggal yung buo at na-examine, hindi natin malalaman, no?
Yes, Doc.
Pero, based on itsura, maliit pa, no? I mean, hindi ba masyadong kalakihan, no? Saka small,
Opo.
yung may takip siya, nasa ilalim ng mucosa yun. No? So malamang ito, no? Okay?
Isa na nga po.
Okay? So, pero hindi pa tayo sure, pwede pa rin ito. Isang check, ha? Okay?
Yes, Doc.
Yes po.
So, ang suggestion ko, i-refer na kita, ang suggestion ko, tanggalin na lang. Okay? Habang, kasi pag umabot sa itaas yan, hirap operahan yan. No?
Apo.
Esophagus kasi mahirap operahan ng esophagus. No? Habang andito pa, so baka pwede pang, kasi kita mo may stocks yan, di ba? May konting,
Yes, Doc.
okay, parang nakapatong, no? Okay. So baka pwedeng tanggalin ng ganito, no? Habang maliit pa, no? Okay. So pag
Yes,
tinanggal na, ganitong tanggal, dahil itatahi, no? Okay. Okay. Or, depende sa gagawa sa'yo, baka mas malaki tanggal, no? Okay, baka tanggal. No? Okay. So, pero eventually, bottom line is operation na rin. Operation talaga. No? Kasi,
Apo.
I don't think liit pa yan. No? It's really a tumor. No? Okay? So, hindi siya inflammation lang. No? Okay?
Yes, Doc.
Naintindihan mo? So,
Yes, Doc. Doc.
i-cancel mo lang kay Yasay. No?